Good day, everyone. Today, our group will be presenting on osteoarthritis. Our group members are Gabrielle Hamilton, Dominique Mattis, Brianna Jackson, Amelia Ebanks, Ashani Green, Sadian Marson, and Anastasia Forster. All right, so let's get into our case study. So, Mrs. Jones, a 55-year-old, came to a musculoskeletal specialist seeking advice for a 3-year history of progressively worsening pain in both knees. Her knees were stiff for about 20 minutes when she arose in the morning, and for a few minutes after getting up from a chair during the day. She had difficulty walking less than 30 minutes because of pain, and her symptoms were exacerbated by kneeling, squatting, or descending stairs. Although sitting, resting, and reclining relieved her pain, she became stiff if she stayed in one position for too long. Her symptoms were worse on humid or cold days, and she occasionally felt as if one of her knees would give out. Question 1. Compare and contrast osteoarthritis with rheumatoid arthritis and explain why Mrs. Jones' symptoms are suggestive of osteoarthritis. All right, so osteoarthritis typically has a slow onset. This is over a period of a few years and it usually begins later on in life. Rheumatoid arthritis, however, can occur at any age with a relatively rapid onset of as short as a few weeks or months. Joint ache and tenderness are present in osteoarthritis, but unlike rheumatoid arthritis, there is little to no swelling. Also, patients with osteoarthritis experience morning stiffness for less than an hour, and the stiffness will usually return after periods of activity. But in rheumatoid arthritis, this stiffness can last longer than an hour. Symptoms of osteoarthritis begin gradually and are often limited to one set of joints, usually the finger joints or large weight-bearing joints like the knees. Therefore, Mrs. Jones' symptoms are suggestive of osteoarthritis in a number of ways. Her morning stiffness only lasts for 20 minutes, and the pain is made worse upon activity. Additionally, her history of symptoms is over a 3-year period, which would all indicate the slowly progressive nature of osteoarthritis.
What are the risk factors for osteoarthritis and what preventative teaching could have been provided to Mrs. Jones years prior to help her prevent or slow the disease progression? Risk factors. There are many risk factors that make an individual susceptible to developing osteoarthritis. These include age. The risk of osteoarthritis increases with age. Osteoarthritis is connected to wear and tear of joints. Gender. Osteoarthritis affects both men and women. It is more common in women as they age. The increase of osteoarthritis in women usually occurs at the time of menopause with hormonal issues and with a connection between estrogen and joint health. Injury. Injuries related to sports, vehicle accidents, or fall can increase the risk of osteoarthritis. Even injuries that occur many years ago and seemingly heal can increase your risk of osteoarthritis. Congenital abnormalities. People have abnormalities form joints that are congenital abnormalities. These joints are vulnerable to wear and tear, causing early degeneration, joint damage, and disability. Obesity. Carrying extra weight contributes to osteoarthritis in several ways, and the more you weigh, the greater your risk. Increased weight adds stress to weight-bearing joints such as the hips and knees. Also, fat tissue produces protein that can cause harmful inflammation in and around joints. Occupation. Jobs that put stress on your joints or require repetitive action or bending can increase your risk for osteoarthritis. Job activities that put strain on your joints include those where you are kneeling and squatting more than an hour daily, climbing steps, doing a lot of walking, and practicing in joint intensive sports. How to prevent or slow the progression of osteoarthritis? Exercise. So low impact exercises can improve joint health. Regular exercise can prevent or even slow the progression of osteoarthritis. Exercise helps to maintain healthy joints, relieving stiffness, reducing pain and fatigue, increase muscle and bone strength. Maintain a healthy weight. If an individual is at a healthy weight, maintaining that weight may be the most important thing to do to prevent osteoarthritis. If an individual is overweight, losing weight may be the best hinge against the disease. Losing weight can help to reduce pain and improve symptoms. Rest. Exercise can help to develop healthy joints and muscles, but overuse of joints can increase the risk of developing osteoarthritis. The key is balance. If your joints are swollen and achy, give them a break. Try to avoid using swollen joints for at least 12 to 24 hours. Letting any injured joint heal helps to reduce the risk of developing osteoarthritis in the future. Control blood sugar. So diabetes has a significant risk factors for developing osteoarthritis. High glucose level can speed up the formation of molecules that make cartilage stiff, and diabetes can also trigger inflammation that accelerates cartilage loss. Keeping diabetes under control and regulating your glucose level can help to prevent osteoarthritis. Finally, eating right. No specific diets have been shown to prevent osteoarthritis, but certain nutrients have been associated with reduced risk of the disease or its severity. They include omega-3 fatty acid. These healthy fats reduce joint inflammation, while the unhealthy fats can increase it. Good sources of omega-3 fatty acid include fish oil and certain plants, nut oil or nut oils, including walnut, canola, soybean, flaxseed, linseed, and olive. Vitamin D. So vitamin D supplements decrease knee pain in a person with osteoarthritis. Your body makes most of the vitamin D needs in response to sunlight. You can get more vitamin D in your diet by eating fatty fish such as salmon, mackerel, tuna, sardines, and herring. Vitamin D, fortified milk and cereals, and eggs.
Question 3. Discuss how the pain of Mrs. Jones' disorder can affect many aspects of her life. The frequency of the knee pain Mrs. Jones is feeling can affect many aspects of her daily activities and may even lead to physical disability. Mrs. Jones may find it difficult to complete simple activities such as walking or climbing up a flight of stairs because the pain of her disorder may be too unbearable.
Question 4. What are some non-pharmacological and pharmacological interventions that may help Mrs. Jones? Non-pharmacological intervention. Obesity. This is a risk factor for the progression of osteoarthritis. Decreasing weight by dietary weight loss is a treatment option that might be offered to the patient. Weight loss therapies have been researched extensively in knee osteoarthritis patients, and they have demonstrated to be of moderate benefit. Aquatic workout. So aquatic workouts have a number of advantages over land-based exercise therapy. Because water buoyancy lessens the compressive pressure that joints must bear, it can be employed in patients who find it difficult or uncomfortable to exercise on land under normal gravity settings. Pharmacological interventions. Acetaminophen. This is a low-cost analgesic that is used as first-line therapy in osteoarthritis. It can be used on as needed basis when mild pain arises. Analgesics. When symptoms of osteoarthritis are minor, topical analgesics can be utilized to treat the joint locally. Glucocorticoids have an inflammatory glucocorticoids have anti-inflammatory properties and have been found to decrease the formation of collagenesis, which involve in cartilage degradation in osteoarthritis. Intra-articular glucocorticoids can be used to treat osteoarthritis, particularly in patients who do not respond to NSAIDs.
Question 5. Mrs. Jones' condition worsens and she is scheduled for total knee replacement. Discuss her nursing care needs following surgery. Be sure to include collaborative care needs. Knee replacement is a surgical procedure where portions of the bones that form the knee joints are removed and replaced with artificial implants. This procedure is done on patients who have severe osteoarthritis to reduce pain and stiffness. The nursing care needs following total knee replacement surgery is to number one, comfort. Administer pain medication as prescribed and monitor for the patient for side effects. Number two, nursing care need is nutrition. Administer IV fluid to maintain fluid intake. Number three, safety and security. Perform wound care using strictly aseptic techniques to reduce the risk of infection. Number four, safety and security. Observe and record vital signs, color, warmth, sensation, and pulses of the surgical limb and wound. Number five, comfort. Assist patient with hygienic and toileting needs. Mistress Jones will engage in physical therapy as part of the post-operative treatment after total knee replacement surgery. According to Hospital for Special Surgery 2021, rehabilitation or physical therapy commences as soon as a patient is medically stable or after 24 hours after surgery. This is done by a physiotherapist. Physiotherapists assist the patient with appropriate exercises such as transferring in and out of bed safely, walking or climbing the stairs with walking devices such as walkers, cane, or crutches. These exercises are done to improve the patient's range of motion and help prevent circulation problems and strengthen their muscles.
Question number 6. Mrs. Jones is ordered a CPM machine following surgery. Please provide a detailed teaching session about the benefits, use, and safety measures of using this device so Mrs. Jones will utilize the device. What is a CPM machine? A continuous passive motion machine is a motorized device that is used to move a joint without the patient having to exert any effort. A specific range of motion would be preset, which would allow the joint to bend back and forth to a fixed number of degrees. The healthcare provider is also able to adjust the amount of movement and speed required specific to the patient. Benefits and uses of a CPM machine. There are numerous benefits to using a continuous passive motion machine, which include an increase in range of motion of arms and legs, blood flow, and muscle strength as a result of the machine flexing and exercising your joints. The machine will also elevate your arms and legs to decrease swelling, to alleviate or reduce pain. A continuous passive motion machine is used when a person undergoes any surgery affecting the joint or suffers from any condition that causes joint stiffness, such as osteoarthritis or a fracture. Safety precautions for using CPM machine. When using a continuous passive motion machine, there are several safety measures to be followed. These are: ensure to plug out the machine when it's not in use. Keep machine away from open flames and liquids. Keep loose objects such as clothing away from machine. Use machine on a flat surface to prevent machine from falling. Keep machine fully visible while using. Machine should not be concealed by clothes or bed linen. Ensure not to leave machine on floor, as this can lead to falls. And these are our references.